Sit down, buckle up, and get ready to learn some exciting things about bacteria. Mentally prepare yourself for some awesome memes. This is Staphylococcus aureus. You might know it as MRSA. It is a gram-positive bacteria that started off as susceptible to methicillin, but has become resistant to most antibiotics by the acquisition and insertion of the SCC-MEC element that contains the MEC-A gene for coding for antibiotic resistance. This bacteria causes infection in both humans and animals, and due to limited antibiotic efficacy against it, it has become a nightmare of a problem in both animal and human health industries. It has thus created a global One Health problem. The groups of people most at risk of contracting MRSA include human and animal hospital patients and staff, patients that are critically ill, immunocompromised, elderly or really young, and those that have had or are receiving ongoing antibiotic treatments, and those in close proximity to people or animals infected with MRSA. Since you're all animal or human health students, we're assuming you've worked out that this is important to you.
Fun fact, did you know that MRSA is transmitted through direct contact with wounds, discharge and soiled areas? Gross, right? Contaminated catheters or needles and poor hygiene also helps MRSA transmit too. Bumps or infected areas on the skin might be red, swollen, painful, warm to touch, and full of pus. If you're squeamish, look away.
Signs of MRSA infection include fever, chills, depression, lightheadedness, confusion, body aches and muscle pains, inflammation and tenderness, chest pain, cough, difficulty breathing, headaches, rashes, and prolonged healing. If you suspect that you have been exposed to MRSA or show any of these signs, contact your local doctor ASAP. And all you new grad doctors and nurses out there, make sure that you read up on the current policies and guidelines to follow. You have the power to control this issue.
Thankfully, there's some pretty good news after all that. Managing MRSA is actually easy. For those future medical professionals watching, please stay on top of maintaining good personal hygiene practices such as hand washing, wearing gloves, and not sharing personal items. Most people would find it gross if you didn't anyway. Spread awareness and educate your future peers and staff, and learn all about the safe use of antibiotics, and teach your patients to never share their antibiotics and only take prescribed antibiotics following dosage instructions. If you're unlucky enough to become a patient, listen to your doctors and take your drugs and keep your wounds covered and clean. Also make sure your friends who visit you in hospital maintain good hygiene, otherwise they'll end up in the bed next to you. MRSA is a big global issue. As medical students, you have the power to make a change, work together, do your homework, and use your One Health approach to manage and hopefully eradicate MRSA strains.